Hello. So for this week's journal discussion, we are talking about transference, countertransference, prejudices, biases, or judgments that have been passed in my clinical experience. So far, I have had a transference experience with a patient where there was a male and it was an actual teenager, and he had been at a previous psychiatric hospital, and it had been all over the news, sadly, but one of the doctors there had been doing a lot of molestation to some of the kids there. And this particular kid had issues with all healthcare staff at that point. It was hard to gain trust with him, and it was hard for him to even open up to you and let you know what was going on to be sure that he is cared for properly. So he had issues with not only the nurses, but also, the doctors. So when I first initially met him, he was just very shut down, very isolated, very withdrawn, and he didn't like to talk. So everything that we kind of did his assessment on was based on his past experiences and what we could get from his chart. Eventually, after him being there a few weeks, I would say maybe one or two of the staff he did start to open up to more. Thankfully, I was one of them. I didn't give up on him. I continued to work with him. Even though he didn't want to listen, he didn't want to talk to me, I continued to talk and assess him and try to ask him how he felt, and ask him if he didn't want to verbally talk to me, if maybe he could write it down. And I also tried to do a lot of groups with him at work, as well as trying to give him his medicine. Most of the time he refused it. He eventually did start taking it. I do understand everything that he was going through, so I didn't at all, of course, pass any judgment on him. I more felt sorry for him, but I had to continue to be professional while also showing empathy and sympathy. I've not had too many issues with transference with patients. Now, with countertransference, I had a situation myself that was personally affecting myself. When I was a young girl, one of my cousins were kidnapped, and it happened in front of me. She was sorry, I'm coughing. She was 8 and I was 6, and I knew the person that did it to her because like 3 or 4 weeks prior, he had wanted to stop my mom's car one day because he knew my father, and I remembered him. And he had walked up to us when we were sitting outside on my aunt's porch, and we were eating candy, and he asked her to show him the address that he was looking for. When my cousin went to show him the address, he grabbed her and snatched her and threw her in his car. Even though it's been so many years ago, I still get emotional talking about it. Thankfully, she did get away. She was able to get away from him, but he did rape her, sadly. And she's dealt with a lot of trauma over the years, one of them almost being not being able to have children. So my situation with countertransference, I had a young lady that I work with. About 2 years ago, she had been sex trafficked, and it resulted from her father being deported back to their country, and she was left here with an aunt, and her aunt wasn't, a good role model. She wasn't there to take care of her like she should, so sadly she ended up on the streets. And she told me she had been raped so many times, and she just told me all the things she had went through with a lot of different men, even women. And she had been sex slaved, and it was sad because we had her because a man had actually been trying to get her. She was at the hospital, and the man who I guess considered her pimp, he was trying to, he came to the hospital and tried to take her. They had put the hospital on lockdown in order to keep her safe, and he ended up getting away. But she talked to me and told me how she was scared of him and how she knew he was waiting on her to come home, and they were, get out of the hospital and be discharged. She had been admitted to our acute care setting, and then they took her to the residential setting. I met her when she came back to acute because she tried to attempt suicide. And the young lady looked so much like my cousin. Like, they had the same facial features, they were the same size. She was maybe, I think, 14, 15, but she just reminded me so much of my cousin. And then hearing the trauma she had been through and the rape that she had went through, and her just talking to me and opening up about everything she went through, I will say that I did take a liking to her. I don't feel that I showed her favoritism because I did treat all of my patients the same, but I do know that I did take a liking to her, and I did always come in and just check on her well-being and her emotional status like I did with everyone else. But I did put a little bit more time into her, and I do feel like it was because of her reminding me of my cousin. I do feel like I kept it professional, but I will say that there was a situation where there was countertransference because it was hard for me not to see my cousin and her because of the trauma and then her physical appearance as well. She took a liking to me as well. I did make sure to keep it professional, so I no longer spoke to her, of course, once she left. I think about her a lot. Hope she's doing well. hope the man that, was her pimp didn't get her. But that is my personal situation with countertransference. Prejudice and biases and judgments. I don't really think that I've encountered that much myself personally. Well, yes, I have. I'm sorry. Take that back. Working in mental health, I do, because of, again, like I said, my trauma as a child with my cousin. When I work with pedophiles and sex offenders, it is hard for me. I have to keep a good poker face. I have to be professional with them. I have to treat them the same way I treat other patients, and I do. But I will say it's harder because I do. I'm sorry, I'm just not comfortable with them. I'm not okay with them. I know that it's a mental condition that they cannot fix. And that's what I've studied a lot about, those who do commit these type of crimes. I've studied a lot about them and a lot about their brain because of the way it traumatized me as a child. So I know that even though they go to therapy sometimes they take medication, they do a lot to try to help themselves. Also, a lot of them go to prison, but in their mind, that thought is just always there, and I know that, so it's hard for me to work with those patients. So that's probably the only bias I have in healthcare, but like I said, I continue to be professional, and I, I work with them like I work with everyone else. I think I answered most of the questions. Have I encountered this before? Yes. From where does this originate? I described both. And would it be appropriate for me to continue to provide care to patients? If so, yes, I do think so, because I am able to be professional no matter what. If I do ever feel too uncomfortable where I feel like I'm not going to be able to be professional, or a patient is going to be able to see or feel my emotions coming through, then I would dismiss myself and get someone else to step in if it's possible. If it's not possible, I'll be as professional as I can. And that's about it. Thank you.